one of the things that comes up really consistently in both the work I do with clinicians in my own practice and also in thinking about supervision in these spaces is this really pervasive idea of what it feels like to sit in a really unfixable space with people. And we can say that from an ACT lens, we do this kind of thing all the time. We're used to dealing with, getting out of content and thinking much more about process and context and all of those things. But there is something deeply different about sitting with another human, particularly in this end of life space, when you know that there's the content or the space that they're bringing is inherently unfixable. The experience that they're having in that context is really appropriate, um, but also for us to sit with, really challenging. If we think about what brings people to see clinicians, psychologists, therapists in these spaces, it's invariably that they're seeking witness and wanting people to sit with them in these spaces. And so that for us as clinicians brings some really challenging spaces. And so, what I guess I think is a really kind of key or a superpower to being able to do end of life work and probably work in other spaces as well, but it's particularly evident in this end of life space, is that if you can work out how you manage your own feelings, distress, discomfort, existential tug, whatever that thing is, in sitting in those moments to be able to sit and observe and be present to without getting pulled into content, without getting pulled into having to do something, then that actually opens up a whole different way of working with our patients at this time. What often patients will find and report is that people are so fast to kind of shut them down or not tolerate the really difficult stuff. A really beautiful example is consistently patients will talk to me about this idea of every time I say I'm worried about something, someone will shut it down and say, no, 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 don't worry about that. You'll be fine. Just be positive. Things will be okay. And of course, often they know that they won't be, and we know that they won't be. And so being able to sit in those spaces and just merely be an observer to that and be present to it and tolerate the churn actually opens up so much really beautiful work that you can do because all of a sudden you're not mirroring what's happening to them in the outside world. You're opening up this different space and a space where really deep work can be done. So I would challenge and encourage you to lean into that, to notice your own discomfort and actually just let yourself be there in that room, in that moment. And that's one of the reasons why doing this work is such like beautiful and powerful things to do. I hope you found that helpful.